Also have Bishop Larry Brandon in studio with us this morning, too. He's going to hang around because he may have some questions of my next guest, who is the brains of the outfit, Dr. John Vanchiere, I believe Chief of Pediatric Infectious Diseases, LSU Health, correct?
Yes, ma'am.
I got it right. Okay. Doc, first answer this. Some people say this is hysteria. We've gone way overboard, canceling the world, and why are we doing it? Is this virus more serious than anything we've seen before, and is that the reason that we're doing what we're doing?
So that's a lot of complicated questions, Aaron.
Yes.
And I guess you're talking about flu virus? Is that the one you're talking about today?
Yeah, the H1N1, where the numbers were much higher back in 2009, all that.
Well, so, the bottom line with this virus is that it's a virus that hasn't been in humans prior to the past few months. So none of us have any protection in our immune system against it, right?
Okay.
We don't have any immune memory of it. So we can't mount a rapid immune response and neutralize it. And the measures that are being taken, closing schools, closing, public gatherings and things, are mitigation strategies. They're reducing risk. And think of it this way. Instead of having a massive surge of infections over a couple of months, the things that we're doing, closing schools and the like, will spread out the infections over several months. And that's what we've seen has been the effect of the things that are being done here that were done in China, and they blunted that curve, is the way it's talked about. That they really changed the trajectory from going up exponentially to flattening the curve. And just think about it. In a country in China of 1 billion people, less than 100,000 people got infected, and that's because they did the right things to slow the virus transmission. Okay. And so that's what we're trying to do here. We're trying to keep our healthcare systems from being overwhelmed by a massive surge of infections that we might not have the capacity to take care of.
Mm-hmm. Doctor, you said do the right things, and I'm a senior pastor at Praise Temple with a large congregation. Of course, when you say do the right things, what are the right things that we should know about? And then also we have people who are concerned about personal space. How far should someone stand or approach or what have you?
Right. So, the personal protection things are things we've been hearing about, good hand washing. And it's important to know that, good old-fashioned bar soap kills this virus. It's not a hard virus to kill and to keep from being transmitted, but you have to do it routinely. You have to, keep your hands clean, after you've gone out in public, after you've turned lots of doorknobs and stuff, because the surfaces are one of the areas where you can pick up this virus. So that's why the hand washing is important. Then, the cough hygiene, cough into your elbow, sneeze into your elbow or into a tissue or something, and then throw the tissue away and wash your hands so that you don't spread germs to other people. The distances that people talk about that are safe distances are, essentially 6 feet. That is to say, if someone's coughing and you're 6 feet away, you're not going to be in their downrange spray of the droplets that would transmit the coronavirus. So, if somebody's not coughing, then that 6 feet would be, really kind of overkill and not necessary. If somebody's not having symptoms, their likelihood of transmission is not zero, but it's fairly low, right?
Go ahead.
Mm-hmm. So, really that distance is going to vary. It's really a judgment call, but 6 feet is considered the safest distance, at least 6 feet away.
Doc, and we're talking to Dr. John Vanchiere, Chief of Pediatric Infectious Diseases, LSU Health. If I were to contract the coronavirus, are there going to be some people who it's just going to be a cold and you're going to get over it? Or will I eventually need some sort of medical treatment to get over it?
No, the vast majority of people are going to have a cold or a bad cold or, what they feel like, I feel like I have the flu. I'm just worn out. I've had fever for a few days. maybe even a week, and I'm just, miserable and tired of all this. It's just going to be that.
And it'll play its course out, and you'll get.
That's right.
Okay, you may not even
It'll
need
play
medical
its course
attention.
out. You may not, and most people will not need medical attention. Exactly.
Okay.
At least
That's good to know.
80% of people won't. Okay. So that's what we're, again, trying to do with all these public health strategies. So closing mass gatherings, because if you go to the CenturyTel for a concert and 20 people in there have virus and are coughing, they could easily infect a few thousand people in one night in just a few hours, and then it spreads incredibly rapidly. So we're trying to keep the healthcare system from being overrun, and we're trying to help educate people that just because you have a cough and just because you have a cough and fever, you don't have to run to the emergency room. You don't want to be sitting miserable in an emergency room. Sort of sitting miserable at home is much more comfortable than sitting miserable in the emergency room when you don't need to. But if you're having, difficulty breathing, can't catch your breath, really sick, then you've got to make a judgment call and call an ambulance. So I'm encouraging people to be connected to their primary care doctor. And, if you have chronic medical conditions or you're elderly, those are the people who are at highest risk of severe disease. And the death rate in people over 80, some of the statistics show maybe it's 10 to 15 or even 20%. Now, that's in places where they don't have the technologies we have, and there are a lot of things different. But you've got to consider elderly and people with chronic illnesses are the high-risk population for severe disease.
But as I hear you speaking to us, that if we talk to you in 2 weeks, you will tell me that the measures we took now helped keep this from spreading more, correct?
Absolutely. Absolutely, I will. Now, you may not see it on the statistical curve yet for a month or 6 weeks, but absolutely, yes. I mean, these measures, they seem extreme. We've never seen them in most of our lifetimes, but they are the right steps to take to really blunt that curve.
So should one limit travel? Should one limit travel?
Yeah, travel is a tough call, and in general, the answer is if it's necessary travel, then it's necessary. But most of us, like going to spring break where there are going to be 1 million people, perhaps, I don't know. That's probably not a good idea. Everybody should rethink judiciously, how important is the travel, because mass gatherings are what's going to tend to spread this virus more rapidly.
Doc, Martha White with the Office of Public Health has told us repeatedly that after we had the one Caddo case, we asked, are there others? She said, yes, absolutely. We just don't know them yet.
Yep.
You feel the same way, but is there any way, and I know you don't want to answer this, is there any way to indicate how many positive cases could be out there in Caddo and Bossier?
So, other than doing a lot of testing, it's going to be hard to pin down that number. The numbers that, from some of the data we have, remember, this has only been studied for a few months, right? Mm-hmm. And all the way around the world. So there's a lot of uncertainty, but the contact rates for potential transmission are anywhere from 30 to 50 people can be infected easily by one person.
Huh.
Okay. So what does that mean in terms of how many cases are out there? Well, we can't exactly say, but it's reasonable to, if the person who is the case here in Caddo that's confirmed is that person had no travel history. So we're saying that person acquired the virus in the community. That tells us the virus is circulating in our community. We don't know how extensively, but we have to assume that it's significant. It's in the probably, tens to hundreds of people already have this virus. But remember, most people have a mild to moderate illness.
Doctor,
they're going to get over it.
What worries you the most?
So right now, worry is spreading faster than the virus itself.
Yes.
And so I think that's one of the things that we have to I want to try to be as definitive as I can about what we know and what we don't know. And there's an awful lot we don't know that we're going to learn. So that's number one. Number two, I'm worried for our elderly population, especially. They're our institutional memory. They're our rocks when we're on shaky ground, and I think we have to be very guarded to make sure that we protect our elderly who are in nursing homes and people with chronic diseases. The most vulnerable in our society are the most vulnerable to this virus, and so that's the big thing that I want to help everybody understand.
Dr. John Vanchiere, Chief of Pediatric Infectious Diseases, LSU Health. Great information. I can't thank you enough for your hard work during this time. Appreciate it, Doc.
All right, we'll talk in whenever you're ready.
You bet.
I'm here.